Thank you for joining Cancer Support Community Atlanta for this nutrition program, facilitated by Kristin Cuculovski, Oncology Nutrition Coordinator with Northside Hospital Cancer Institute. If this is your first time participating in a Cancer Support Community Atlanta program, we invite you to visit our website and complete a new attendee form to stay connected to all future programs.
So today's nutrition seminar is going to be on vitamin D. And like Emily said, we're here for our monthly nutrition seminar. We typically do these on the third Tuesday of the month. While we're doing them virtually, they are at noon. And if you have recommendations or topics that you're interested in, you can send those to Emily and I will try to accommodate throughout the coming months. But I am Kristin. I'm one of our oncology dietitians with Northside. I'm also over our entire oncology nutrition program here. So I just want to give a little bit of a disclaimer. This is more of a general presentation on vitamin D. If you have specific questions about like dosing that you should be on, if you have specific conditions, then you really should ask your doctor for those. If you're within the Cancer Institute at Northside, like if you're at a Georgia Cancer Specialist or Atlanta Cancer Care, maybe a radiation clinic, all of those are covered by a dietitian that's on our team. So they can look through your medical records, talk to you about very specific stuff. So please keep that in mind when you have questions going through. I did see some questions that came in early and some of them were really specific and maybe could be based on your age and some of the other conditions you have going on. So for very individualized care, that's always an option for you to go that route. And you can we're a free service through the Cancer Institute, so you can ask your medical oncologist or your radiation oncologist to send a referral on your behalf, and we will try to get you scheduled at a time that works for you. So let's see here. All right, so vitamin D. What is vitamin D? It's a very interesting topic. It's always in the news. It's a very hot, controversial topic from time to time within research. So vitamin D is a nutrient that we eat, but it's also a hormone that our bodies make. So it's very unique in that sense. It is one of our fat-soluble vitamins. A fat-soluble vitamin means that it dissolves with fat and then it's absorbed in our intestines with fat. And we'll talk a little bit more about that, but that's typically what a fat-soluble vitamin means. And then vitamin D is best known for helping our bodies absorb calcium and phosphorus for bone health. We'll talk a little bit more about that. And then vitamin D exists in two different forms. So there's vitamin D2, and that is produced by plants or in plants. And then there's vitamin D3, which is produced in animals, including humans. So we'll talk a little bit further about that later on in the presentation. But vitamin D production in our skin is the primary natural source of vitamin D. So we'll talk a little bit more about that too. It's just a little overview. All right, so vitamin D is naturally found in very few foods. So very few items actually have vitamin D that's naturally occurring. So in the US, at least, we have added vitamin D to other foods. So that's more of what we would call a fortified food. A good example of that are fortified cereals. So a lot of our ready-to-eat cereals that you buy in the cereal aisle have been fortified with different nutrients, but vitamin D might be one of them. Fluid milk, like dairy milk, is also fortified with vitamin D. So it usually has calcium in it, but might be lacking in vitamin D. So they add that in. So that is a fortified food option. I think they're also fortifying more things like orange juice, maybe some of the nut milks as well as an option. So that's another way that we get it. Dietary supplements are another source for us. And then, like I said before, it's also produced by our skin. And that process, the UVB rays from the sun, trigger the vitamin D synthesis within our skin. So another nickname for vitamin D is the sunshine vitamin, and that's where that comes from. So vitamin D has to undergo two processes in our body to actually become an active form of vitamin D that we can utilize. So the first process goes on in your liver, and your liver converts vitamin D to a 25-hydroxy vitamin D, or 25-OHD. And then from there, The second step occurs in your kidneys. So your kidneys actually convert it into the physiologically active form, and that is called 125 dihydroxyvitamin D. So you don't have to remember those words. Just know that it's a little bit of a process to get either from your skin to being an active form, or even if you eat it, that it also is going to be converted through this two-step process here. All right. So as far as absorption goes, vitamin D, again, is made in the skin. It's also absorbed in our small intestines from foods that contain vitamin D. So for adequate absorption of vitamin D in the diet, at least 10% of calories need to come from fat, because vitamin D is a fat-soluble vitamin. So a lot of times if you buy like a vitamin D supplement on its own, you might look at the food label and it's got a certain amount of fat in it, and that's usually why, to make sure that it's going to be absorbed. But also if you're taking it alongside of a meal that has some healthy fat in it, that will help with the absorption of that as well. So if you're following like a super low fat diet, you just want to be a little bit careful with some of your fat soluble vitamins, because you do need some fat to be able to absorb these nutrients. And then we can store vitamin D in our liver, skin, brain, bones, and other tissue to be utilized later. So what all does vitamin D do? It does a lot of stuff, and there's still a lot of stuff that we don't even know about vitamin D yet. But again, it's best known for our bone and teeth health, and that helps to promote the absorption of calcium and phosphorus from our blood for the development of the bones and teeth and keeping those both strong. It's also important for maintaining a healthy nervous and muscular system by helping to regulate those blood calcium levels. So they work very nicely together. And then many cells have vitamin D receptors that help cells communicate. So there's actually a lot of tissues and different organs that have vitamin D receptors on them. And so a lot of the researchers think that, you know, vitamin D is very important. It just might not be as well understood yet as it will be in the future. So vitamin D also keeps minerals balanced in our bodies. It helps to improve our immune system, which is always a hot topic. And then it also can help reduce inflammation in our bodies. So you might be thinking, well, how much vitamin D do I need? And so these are the recommendations from the Institute of Medicine and also the Endocrine Society. So they're pretty similar. The Endocrine Society just gives a range, where the Institute of Medicine is more along the lines of the recommended dietary allowances for the day. So your RDAs. So if you're between the age of 1 and 70, 600 international units is what's recommended for daily maintenance. And then if you're greater than 70 years, it's going to be 800 international units. So I'm going to show you a picture of the food label here in a couple of slides. And on the food label, it actually has how many micrograms you need per day, or how many micrograms are in whatever product you're buying. So you can see out here that if you're shooting for 600 international units, that's going to be 15 micrograms of vitamin D in food. So you might see that your yogurt or something has 2 micrograms in it. So that's 2 out of the 15 you need for the day, depending on how old you are. So like I said, the Endocrine Society is also along the same lines. As far as the bottom half, they just gave an upper range of what you may need to go to, depending on maybe your level of vitamin D, but also if you're at higher risk for becoming deficient, and what it would take for you to stay in a sufficient range. So the upper limit of vitamin D is 4,000 international units per day. So they don't necessarily recommend going over 4,000 international units per day unless you've been advised to by your doctor. They've determined that this should be safe for most people. All right, so some people might need more vitamin D. So those people include anybody who has intestinal fat malabsorption syndrome. So people suffering from Crohn's disease, sometimes irritable bowel. Some of our pancreatic cancer patients who might have fat malabsorption issues may require more vitamin D. If you're taking anticonvulsive medications, you might need more vitamin D. Corticosteroids and related medications under that umbrella, you may need more. Those tend to reduce the amount that's floating around in our blood. If you have less ability to absorb sunlight, so if you're older, you know, our skin changes as we get older, so they don't think that we convert vitamin D quite as efficiently, or if you have darker skin, so olive skin and just to darker skin, you have more melanin, and that can reduce the amount of vitamin D that you're able to produce. If you have excess fat or are obese, so vitamin D can be stored in fat, because it is one of those fat soluble vitamins. However, we can't really get it back out once it's stored in the fat unless you start losing weight. So it's not like, you know, if you have a lot of abdominal fat, you might have some vitamin D stored in there, but if your blood levels get low, your body's not able to pull it out of the bank, basically from those stores. But they have seen that as obese people start losing weight, that their vitamin D serum levels tend to go up, and that is what they think happens in that instance. And then if an infant is breastfed and not exposed to sunlight, a daily supplement of 400 IUs is recommended. So let's talk about where you get your vitamin D from. So these are the food sources on the left-hand side, and then it has international units per serving over on the right side. So cod liver oil, a tablespoon, is 1,360 international units. So if you think about the highest range that we have as far as daily recommendation of 800, this is over that 800. So that is an excellent source there. You get everything you need in just 1 tablespoon if you love cod liver oil. Swordfish cooked at 3 ounces is going to have 566. So almost to that 600 mark, not quite to the 800 mark, but a very good source here. Salmon, wild caught, 3 ounces, the same, it's at 447. Tuna fish that is canned in water, drained, 3 ounces is at 154. You can see orange juice that's been fortified, a cup. You're gonna have to check the labels because it's really at the discretion of whoever's manufacturing and how much they're gonna put in. But this example has 137. Milk that's non-fat, reduced fat, or whole milk, they fortify it pretty much with the same amount of the vitamin D. It's usually around 120, but this has a range of 115 to 124. Your yogurt, every yogurt again is different. I just checked my yogurt and it says 10%, not 20%. And then sometimes it's unclear what daily value they're looking at. So typically what I've been able to find online is that it's based off of that 800 international units. So they just picked whatever the highest recommendation was for those 70-plus-year-olds, and that's kind of how they pick the percent, but that's not always a guaranteed marker for that. So in the future, they're going to have to tell you exactly how many micrograms are in it, but this yogurt doesn't have that food label on it. It just says 10%. So a little confusing there. Sardines, liver, beef that's cooked has 42 grams. 1 large egg. The vitamin D is actually found in the yolk of the egg. So if you're only eating egg whites, then it's not going to be a good source of vitamin D for you. The egg whites have a lot of the protein, but a lot of the vitamins and other nutrients are found in the yolk. So if you're limiting those, you shouldn't count that as a source of your vitamin D. And then ready to eat cereals, like I said, they could be fortified with any kind of amount. So that's just something you have to check on the food label. And then cheese Swiss only has 6 international units there. All right, so here's our food label. So this one here, I don't know if you can see my mouse, but there's a current food label that you may still be seeing. And then there's a new food label that is coming out. And a lot of companies have already rolled out the new food label, and it should be done in the next couple years to have everybody across the board having this new label. But for now, you may see either or. So it's interesting if you look down at the orange section, that's number 5 with the nutrients. They changed from the old to the new. So now they're including vitamin D down here, and you can see that it says 2 micrograms, and 1 microgram equals about 40 international units. So this product here has about 80 international units of vitamin D in it. And then you can see over to the right, it says the daily value is 10%. So 10% of 800 is going to be 80. So they're using that upper range of the 800 international units as their reference for this specific food. And I'm hopeful that that's what they're you know, it's going to be across the board, but I can't guarantee that, and I couldn't find that information online. But they're also going to require calcium, iron, and potassium to be listed on the new food label as well, where the old food label just had vitamin A, vitamin C, calcium, and iron. And vitamin A and vitamin C, the US doesn't really see a whole lot of deficient people in vitamin A and vitamin C just because it's so common in our food sources. So vitamin D and calcium and potassium and iron were the more risky ones that they wanted to make sure they were highlighting on the new food label. So hopefully you guys can keep an eye out for that as you go through the grocery stores and you're looking for foods that have been fortified with vitamin D here. And that's how you would do that. And then if you're looking at vitamin D supplements, so there are 2 forms that are available, and this is always a question, do I need vitamin D2 or do I need vitamin D3? So most of the research shows that both products, D3 and D2, go through the same metabolism and same actions to get absorbed. There's a little bit of a difference in a side chain in the chemical structure of it that just makes it a little bit different. And again, the D2 tends to be found in more plant foods, so like mushrooms, and then D3 is more in animal products, including humans. So we make D3. And so a lot of researchers, like when they're trying to pick between the 2, they tend to lean towards D3 just because that's the form that we also make. But in most studies that have been done, both versions seem to effectively raise the serum levels of your vitamin D. So there's not necessarily one is better than the other unless your doctor has a specific preference on which one you should be taking. But conclusions about any different effects of the 2 forms can't be made at this time. They appear to be equal. So they do say that if you're taking vitamin Ds at really high doses, that maybe vitamin D would be better because it has less potent, has maybe less GI distress. But that doesn't necessarily mean that it's going to be less effective just because it's less potent. So that is interesting of note. And then if you are going to buy vitamin D supplements, you want to find one that has a seal of approval. So I got a pre-question about the quality, if there's different qualities of vitamin D3 out there. And the answer is yes. So the FDA does not regulate supplement creation at all in the US. So companies can kind of put whatever they want into things. I would hope that it wouldn't be harmful, but you just never know. So there are some companies out there who do third-party testing of supplements. Consumerlab.com is one, and they have this little beaker that's down in the right-hand corner. That's their seal of approval. The NSF International Dietary Supplement Certification is this NSF circle you might see. And then the US Pharmacopoeia Dietary Supplement Verification Program. I was looking them up more today. It looks like they've been around for about 200 years. And that's the one that I see the most common. So that's that USP circle there in the middle. And so basically what their role is to look at what the company says is in the supplement. And then they test to make sure that that is what's in there, that there aren't harmful, extra harmful heavy metals, that kind of thing that were being added in as fillers, and that they're using active forms of the ingredients. So I brought a prop today. This is Costco Daily Multivitamin, and you can see the USP label here. So that's how I typically, if I'm going to buy a supplement, I always try to find a seal from one of these 3 companies just to know that it has been tested and what Costco is saying is in their product is actually in their product, or whoever you're buying it from. So as a disclaimer, just because a brand, like say you love Nature Made vitamins, you have to check every supplement that you're buying. So sometimes, you know, your Nature Made vitamin D might have the USP label, but your vitamin B doesn't. That's just an example. I don't know. They might both have them. I'm not sure. So you can't just be like, oh, all Nature Made have been tested. I wouldn't give that blanket statement. So I always just look for this USP. And then the other thing when you think about vitamin D supplements too is you have to check if you are taking a multivitamin, they typically contain vitamin D. So this one has 10 micrograms or 400 international units. So this is 50% of your vitamin D that's already recommended. So you may not need another large dose of vitamin D separate if you're taking other vitamins and supplements that have some of these things built into them. So just keep an eye out for that you're not overdoing it if you are doing a supplement. So historically, they've always recommended that you check with your doctor, check to see if you're vitamin D deficient or deficient in anything before you start doing a lot of supplementing. So we'll talk a little bit about the lab testing and that kind of stuff in a minute. Lastly, with the sources, sun exposure, most people meet at least some of their vitamin D needs through the sun. So you have to think about what your current lifestyle looks like. Do you go out and get in the sun? You know, with a lot of people staying at home nowadays, I swear the sidewalks are just packed with people who are out walking. And I feel like my neighborhood has gotten more vitamin D in the last 3 months than they probably have gotten in their lifetime, because they're always outside now. Where they probably used to work a lot inside in offices, not being exposed to a lot of sun. So sometimes this will change. Again, sometimes you're more active in the summer and you're less active in the winter. So you may just have to look to see how often you're getting sunlight and your level of sun protection that you go through. So UVB rays are the ones that actually convert the vitamin D under our skin. So you have to be exposed directly to sunlight to get UVB rays. If you're counting on sitting in your car on the drive home and you have your arm up and sun is shining on it, the UVB rays don't come through glass. So you're just getting UVA rays that are going to age your skin versus getting those UVB rays that are going to convert the vitamin D for you. And then of course, you know, you do have to be careful. You don't want a lot of sun exposure at any given time. You don't want to burn your skin, and you want to be very careful, especially if you're on chemo. A lot of chemos make you light sensitive and UV sensitive. So just be cautious here. But UV radiation is a carcinogen. You know, there are a lot of skin cancers that happen in the US every year. So we just want to be careful with this route. And I saw a statistic that said SPF of 8 or greater significantly reduces your ability to make your vitamin D. And then if you're using sunscreen like you're supposed to, it decreases the absorption rate by up to 90% or greater. So if you're wearing sunscreen or you're wearing, you know, long sleeve clothes and you've got your hat on and you're just really limiting your sun exposure, you may not be getting your vitamin D from sun exposure. And that's always like I have to weigh the benefits with the cons there. So that is sunlight and sun exposure for vitamin D. So should everyone be screened for vitamin D deficiency? This is always a hot topic. Sometimes your insurance doesn't cover it. It can be a pricey lab test that can be done. Sometimes doctors are more hesitant to order it just willy-nilly. So no, the recommendation is not to mass screen everybody for a vitamin D deficiency. However, if you fall into some of these risk factors, then you might be more likely to have vitamin D screenings done. So risk factors include being malnourished. So that could be true like calorie protein malnutrition, where you've lost rapid amounts of weight, maybe while you were going through treatment, can cause malnutrition. People who are on very restrictive diets can become malnourished if you're cutting out a lot of different food groups, that kind of thing. Sedentary lifestyles, again, you're sitting inside all day, working or playing video games, or just not able to get out very often. Limiting your sun exposure, so whether you're doing that on purpose or again because your lifestyle just doesn't allow for it. Obesity can be a risk factor. Having dark skin, also a risk factor. Being over the age of 65, sorry. GI malabsorption, so again, if you have short bowel syndrome, pancreatitis, irritable bowel, celiac, if you've had bariatric surgery, that could put you at increased risk for vitamin D deficiency. Liver disease or having liver failure. So remember, your vitamin D has to be converted in your liver. So if you have issues going on with your liver, that could hinder that process from happening. Same thing with your kidneys. So if you have renal insufficiency or nephrotic syndrome, that could lead to a vitamin D deficiency. And then any medications that could alter the vitamin D metabolism. So anticonvulsants and those glucocorticosteroids can bring down the blood serum of your vitamin D. So that could put you at risk as well. So if you are going to be screened, the recommended lab value that you're looking for is the serum concentration of the 25-OHD. That's the best indicator of your vitamin D status that we have right now. It reflects both the vitamin D that's going to be produced in your skin and that's obtained through your food or supplements that you're taking. So it does not indicate the amount of vitamin D that you might have stored in your body tissues though. So this is your free floating blood serum vitamin D level. The other screening or the other lab test that's out there is the 125-OHD or 2D test. And that one's not recommended because it has a very short half-life. So it's really only what you've maybe consumed in the last like 15 hours. So it's not as good of a representation of maybe what all's going on. So you want to look for that 25-OHD lab test. And that's usually what physicians will order. So let's say you got your test done. What's a normal range? So a little controversial, but kind of similar. So you've got the Institute of Medicine again. So their like range that they prefer to see people in is anywhere from 20 to 50. Sufficient levels are anything greater than 20. And then they start to think that you're at risk for deficiency or you're at an insufficient level if you're from 12 to 20. And then they consider you to be vitamin D deficient if you're less than 12. But the Endocrine Society, who deals more with hormones and your endocrine system, they have a slightly different ranking here. So they prefer people to be between 40 and 60. And they consider being at a sufficient level anything greater than 3. So shoot for 40 to 60 to prevent insufficiency, which is why those numbers are a little bit different there. And then they consider you to be insufficient at 21 to 29 and to actually have a deficiency if you're less than 20. So they're a little bit different. Sometimes these lab values change depending on what lab you go to. You'll see if you go to like LabQuest, they might be one thing. If you have your labs done at Northside, they might be a little bit off, like not off, but just slightly different ranges. So this gives you a nice range of what to look for if you get your blood work back. So there are emerging evidence that links potential adverse effects to high levels, particularly greater than 60 or greater than 150 nanomoles per liter. So I've just been talking in the, I think it's nanograms, but the ng/milliliter. So, you know, sometimes in the US, we are always like, more is better, but more is not always better. So you want to try to maintain in some of these ranges. So I typically go with the Endocrine Society, so 40 to 60, but you know, 20 to 50, 40 to 60, anywhere that's above 20 seems to be the consensus here. So, you know, if you're starting to get greater than 60, you may need to check and see how much vitamin D you're actually getting and maybe what's causing some of those higher ranges, because we don't want to cause damage. And again, you know, a lot of this research is still coming out and vitamin D has been a hot topic in the last several years. So I imagine more and more research will come out in years to come. So symptoms of being vitamin D deficient. Deficiency is often asymptomatic, meaning you're really not going to have a whole lot of symptoms. But some people will say that they feel fatigued or tired. But some severe or prolonged deficiency may have some of the following. So if you're deficient for longer periods of time, it could lead to bone discomfort or pain in your lower back, pelvis, or lower extremities, falls and impaired physical function, muscle aches, muscle weakness. So again, if you had some of these things, you might not be thinking, oh, vitamin D deficient, you know, because I had some muscle aches yesterday. So they're not very helpful in determining. So that's why those blood draws tend to be more helpful. And then if you have prolonged vitamin D deficiency, it can lead to different conditions. Rickets in infants and children, so that's the failure of their bone tissue to actually harden and become more skeletal bone. So a lot of times you'll see like curved legs and just different bone issues in those kids. And then for adults, osteomalacia is weak and softened bones, and it can be reversed with supplementation. So this condition is different than osteoporosis. Osteoporosis you can't really reverse, but the other, if you have softened bones, apparently you can reverse it with some supplementation there. And then I was asked if there's a such thing as a vitamin D toxicity, and there is, and it most often occurs from taking supplements. So it is not advised to take daily vitamin D supplements containing more than 4,000 international units unless you're being supervised by your doctor. So if you are deficient, you may be given higher doses of vitamin D for shorter periods of time to try to get you back up into that normal range. And you could be one of those people that just requires more vitamin D than 4,000. Everybody's a little bit different. So this is just the recommendation for the general public here. So low amounts that we find in our food are very unlikely to reach a toxic level. I don't even know how much liver cod oil you would have to take to get to a toxic level, but I'm sure you would quit before you got to that point. High amounts of sun exposure also doesn't lead to toxicity. So the excess heat that you would get on your skin actually prevents the vitamin D from forming. So if you get too hot or burnt, you're not really going to be helping yourself produce any more vitamin D. So some symptoms of too much vitamin D: poor appetite, excessive urine output, heart arrhythmias, fatigue, excessive thirst, dehydration, constipation, muscle weakness, nausea, vomiting, dizziness, high blood pressure, kidney stones. These can all come if you're at that too high of a range for taking too much vitamin D. Again, typically through supplements. So be cautious. Make sure you're reading labels if you're taking other supplements, those kind of things, to make sure you're not overlapping and dipping in multiple sources of vitamin D supplements. Okay, so I also typically always get questions about vitamin K2. So this is more towards bone health, and what you'll see, some supplements might have calcium and vitamin D and vitamin K together. So I just like to throw this slide in here just so you're aware of it. It doesn't necessarily have to do with vitamin D. But vitamin K2 has become more popular in recent years. So vitamin K has two forms, kind of like vitamin D. There's K1 and K2. So K2 deficiency is more prevalent and potentially linked to heart and bone health. So your serum levels, so doing a blood draw is not going to be very reliable for testing. Again, it's newer. That's not something that's really been focused on a whole lot. But vitamin K2 for bone health helps to activate osteocalcin, which can draw calcium into your bones from your blood. So that way it can rebuild itself. And as far as your heart health goes, vitamin K2, it activates this matrix of some kind of protein, and it's responsible for removing excess calcium that can accumulate in our soft tissues like our arteries and veins. So sometimes, you know, people will say hardening arteries, or my veins are hardening. It could be because of calcium deposits. So they think that K2 can actually help with removing some of that excess. There's actually, here are some sources for it. So kind of the difference between vitamin K1 and K2. So the role in K1 is for coagulation. So if you've ever been on a blood thinner like warfarin or Coumadin, they might have talked to you about your vitamin K. Typically, they don't even separate vitamin K on the food label. So I checked my multivitamin and it just says vitamin K. It doesn't specify 1 and 2. But calcium, or vitamin K2 is for proper calcium utilization. So the food sources are different here. So vitamin K1 are your dark green leafy vegetables and other green vegetables. And K2 comes from more of your animal products. So liver, meat, egg yolks, high fat dairy. And then natto is a Japanese vegetable concoction. And it's really the only vegetarian source of vitamin K2. So the DRI, or the daily recommended intake for vitamin K, the only thing that's listed out there is for like vitamin K as a whole. It doesn't have a vitamin K2 separated. And so it's 90 to 120 micrograms per day. So deficiency of vitamin K1 is rare, and deficiency of vitamin K2 is more prevalent. So if you're not including some of these foods on a regular basis, you might be missing out on some of that vitamin K. And again, it's hard for me to tell you if certain vitamins have, like a multivitamin has K2, but a lot of the supplements that are promoted for bone health tend to say specifically that they have K2 in them. So that's where vitamin K2 has a role. Again, it's not necessarily with vitamin D, but I do get a lot of questions around the same topics when we talk about this stuff. All right, so let's talk about a little bit of research around vitamin D. And there's tons of research going on, but the VITAL study was one of the largest and longest randomized trial of daily high doses of vitamin D and omega-3 fatty acid supplements. So it was looking specifically at vitamin D and omega-3s to see what was going to happen if you were supplementing at more high doses, and was it safe, was it beneficial, that kind of stuff. So it was studying prevention of cancer and cardiovascular disease. The study included 25,871 adults, so a pretty big study here. And the adults had to not have cancer or cardiovascular disease going in. And they were followed for an average of 5.3 years. And they typically were a healthy population, and most of them already had normal baseline vitamin D levels. So they were not deficient. So that's important to remember. So the study, vitamin D, did not significantly lower the risk of developing cancer in the total study population, but there was a suggestive 17% reduction in cancer deaths. So again, they're not really sure exactly why some of these happen. There are theories and that kind of stuff, but that's not necessarily exactly what they were studying. And then they found that African Americans assigned to the vitamin D group did experience a suggestive 23% reduction in cancer risk. So further research is needed to confirm their findings, and studies to date do not support a strong role for vitamin D in reducing the risk of cancer. So they're not necessarily promoting it to prevent yourself from getting cancer. But there have been some other studies. So there was an epidemiologic study that suggested that vitamin D may have a protective effect against colon cancer. And then the data is not very strong for protective effects against prostate and breast cancer, and it really varies on other cancer sites. So some studies will show that it is protective and some show that it's not. So again, research, you guys, it takes a long time to get a lot of these evidence-based recommendations out there. And I know that can be frustrating because you hear certain snippets that come out in the media and kind of stuff. So it's hard to know what you are and aren't supposed to do. But the role that vitamin D can play in cancer, so it may reduce cancer cell growth. It may reduce blood vessels that grow to the tumor. It may help to cause cancer cell death, which is what we're looking for. It does, or helps improve our immune function, so it does play a good supportive role in our immunity. And then it can help with inflammation as well, so helping to bring down some of that inflammation in our bodies. And then they're doing a lot of studies now with the coronavirus and COVID and how vitamin D might be helpful in reducing inflammation. But again, there's just preliminary research that's out there. And typically what I've seen when I'm researching through a lot of these studies is that the people who actually have a deficiency are the ones who see the most benefit from having these supplements versus those who are already in a normal range of vitamin D. And they could be in a normal range because they do have a daily supplement that they're taking. It doesn't really specify that information. Not just for cancer, heart disease is also something that they look at. So deficiency, vitamin D deficiency increases risk of heart disease, anything from heart attack, stroke, congestive heart failure, peripheral artery disease, high blood pressure, arterial wall thickening or hardening, and then inflammation. So the VITAL clinical trial that we just talked about with vitamin D did not significantly reduce major cardiovascular events like the heart attack, stroke, cardiovascular mortality. But again, their conclusion was they needed to do more research, and it may have reduced it a little bit, but it wasn't significant enough to say. But you also have to remember that these participants that went into the VITAL trial mostly had normal ranges to begin with anyway. So again, deficiency is really where a lot of the research needs to take place. And so vitamin D with other conditions, so growing body of research suggesting that vitamin D might play a role in prevention and treatment of type 1 and type 2 diabetes, hypertension, glucose intolerance, multiple sclerosis. But again, there's not really a whole lot of trials out there that have been done. So we still need randomized clinical trials before they're able to give very conclusive information around that. So I didn't put a COVID-19 slide in here, but I do know that's a hot topic now. And I took a couple notes here. There are currently 14 clinical trials that are open on clinicaltrials.gov that are vitamin D coronavirus specific. So that will be very interesting. They're enrolling patients as they find them. And the majority of the articles and things that I've been able to find is that there's no recommendation for supplementing above whatever the normal recommended dietary allowances. So those RDAs that we already talked about, the 600 international units to 800 international units. So that is pretty much the consensus that I found there. I've seen several media articles that have come out, but again, the doctors who are actually doing the research don't really have a comment at this time regarding those things. So we will still wait and see what comes out of all the research that's being done. But in summary, vitamin D affects more than just our bone health. So it's a pretty amazing vitamin, I think, with all those receptors that have vitamin D receptors, all the cells that need vitamin D. Get your vitamin D levels checked before you start supplementing, or at the very least before you start supplementing really high doses of vitamin D, and then supplement if needed. So you don't always have to do mega dosing before you check your numbers. And if the doctor determines that you are deficient and they need to get you back into a more normal, optimal range, then they will help you determine how much vitamin D you need to get yourself there. And then just as a general reminder, the American Institute for Cancer Research, the AICR, we use them a lot for their research, does not recommend using supplements for cancer prevention. So again, if you're deficient or your diet is lacking or you're not able to get outside and get sun exposure, or you're very cautious with sun exposure, maybe you need a vitamin D supplement. You can talk with your doctor about those. But in general, if you already have a healthy range and you eat a very wide variety of a diet, then you might not need that extra supplementation. So that is all I have for us today.
Thank you, Kristin. That was a great presentation. It does look like we have a few questions in the chat box.
Okay.
If I drink skim milk with added vitamin D, is it absorbed sufficiently?
It should be. So like I said, with the vitamin D, typically if they fortify it, it might still have a little bit of fat. It kind of depends on what else you're eating throughout the day. So it doesn't always have to be specifically at a meal, but as long as you're including, you know, that 10% fat doesn't necessarily have to be at that specific meal.
Okay.
But if you're doing something like a glass of milk and peanut butter toast, you're going to have fat from your peanut butter, or you can have a little avocado, something along those lines to help with the absorption.
Okay, I think that answers Julie's question. Since vitamin D is fat soluble, do you need to eat a meal to metabolize?
I think it's ideal. I don't know if they know the exact specific answer, but if it is a fat soluble vitamin, those typically should be taken with fat.
Is there correlation between vitamin D and creatinine clearance?
I haven't seen anything specific to that.
Is there a test for GI malabsorption that is available to take?
Yes, so usually your GI doctor or your primary care doctor could send you to a GI doctor. They do, it's like a fat elastic test. I think they test the amount of fat that is in your stool to see how much you're absorbing versus not absorbing. I'm sure there are some other ones, but that seems to be a popular one.
Okay. And if you are taking 4,000 IU, what is that a measurement of?
International units.
Oh, international units a day. Can your food intake of vitamin D cause you to go over the recommended levels?
I suppose it could if you're incorporating a lot of those vitamin D foods in there. But also, if you're taking 4,000 because a doctor told you to, you may have, our bodies absorb what they want to absorb from time to time. So on paper, yes, it would probably put you over the 4,000 international units of the tolerable intake level. But that doesn't always mean in specific cases that it's going to be harmful. That was just a number that they saw the general population seemed to tolerate and that it didn't cause issues.
Okay, thank you so much. I went and grabbed my vitamins from the bathroom while you were talking and don't see any of those labels on it. So I think I need to invest in some different vitamins.
Yeah. And I mean, it's kind of like, I don't know exactly how people can get this done. I don't know if like the company has to pay USP to, or, you know, consumer labs to actually do the testing, or if they just pick at random and that kind of stuff. So it's kind of like the organic foods too. Sometimes, you know, large farmers can afford to have the organic label put on there, but some of your smaller farmers may not be able to afford. So there are other options too, but if you're just going to Publix and picking something off the shelf and it tends to be a larger company and they don't have something certified, I would be more cautious.
Yeah,
around those.
That's a good point. It looks like we did have one more question. Mm-hmm. Does vitiligo interfere with absorption of vitamin D?
I don't know what that is.
Vitaligo, vitiligo?
I'd have to look that one up.
Okay.
How'd you spell it again?
Vitaligo.
Okay.
Hey, Kristin, yep. This is Cindy Dominski. Vitiligo is a autoimmune where you lose the pigmentation of your skin. More common in African American, but can happen in Caucasians. So my question is, if you have vitiligo and you have less pigmented skin, would that condition possibly affect your ability to absorb vitamin D from UV rays?
I mean, it could. I have no idea. I would have to look it up because there is like a chemical reaction that happens under the skin or within the skin to create that previtamin. And I don't know if that specific condition would hinder that in some kind of way.
Okay, gotcha.
Yeah. I'll see if I can find an answer though. All right. Well, if y'all have suggestions, send those to Emily, and then I will be back here next month.
Thank you so much, Kristin. If anybody wants a copy of the PowerPoint, I'm sure Kristin will share that and I can email that out to you. We didn't get it out this time. Thank you all for being here and have a wonderful rest of your day. Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.